our speaker. Today, we are privileged to have Eileen Crehan with us speaking about autism and sex education. Eileen Crehan is the Associate Clinical Director and Clinical Psychology Postdoctoral Fellow with the Art Center at Rush University Medical Center in Chicago. A graduate of the Clinical Psychology Doctoral Program at the University of Vermont, she completed her pre-doctoral internship at Civitan International Research Center at the University of Alabama Birmingham School of Medicine. Crehan works with individuals across the lifespan who are affected by autism, with a particular clinical and research emphasis on sexuality education. She also uses eye-tracking technology to explore social perception. She will be joining the faculty at Tufts University in Massachusetts this fall to continue her study of best practices for sexuality education programs and autism spectrum disorder. It's our extreme pleasure to have Dr. Crehan with us today, so without further ado, take it away.
Thank you so much, Vincent. Hello, everybody, and thank you for joining me today. I'm very excited to be here. Clearly a topic that I think is very important, and hopefully by, you're signing on to be here, you think it is important as well. So let's get started. My goal for today is really to focus on these four primary questions. So why is sexuality and sexuality education important as it relates to autism? What do we know already? What are best practices? And what are we going to do next? Briefly, I just want to put a language disclaimer out here in case you're in a setting where other people might be listening. As you might imagine, there'll be some sexually explicit terms that come up in this presentation. So I just want to make sure that I stated that ahead of time to let you know. All right, so why is sexuality and sexuality education important? Why are we here talking about this? So the World Health Organization gives a pretty comprehensive and nice definition of sexuality, and I think the important part of this to me is describing it as a central aspect of being human. Okay? So we are sexual beings. We start developing as soon as we're born. We head toward romantic relationships. Some people do, some people don't. But also sexuality encompasses a really wide range of identities and skills and developmental stages. In addition to all of that, sexuality changes as we move throughout our life. So information that you might need when you're young is going to be different than information you need when you're older. So it's a constantly changing topic. So what in particular are we talking about? Because sexuality is so broad. Generally, the thought has been it's a good idea to keep the definition of sexuality really broad because it means so many different things to so many different people. This is not by any means an exhaustive list of topics that are sort of referred to by sexuality, but I think gives a couple of cornerstones for things that come up in sex education, questions that people might have about sexuality or that you might hear about in the media. I think if we plan for these things proactively, this is a great first step to sort of living a full and fulfilling life as a human and as a sexual being. And then especially in developmental disabilities, a lot of these topics have this underlying emphasis on safety. So we want people to sort of know how their own bodies and identities operate with this idea toward keeping people safe, which is particularly important for everyone, but especially in the developmental disabilities realm. As you may know, individuals with developmental disabilities are about twice as likely to experience some sort of sexual abuse before they reach 18. And so this adds an extra level of importance to sexuality education programming and gives us a lot of, I think, motivation to create some really great programs that we can help to reach a lot of people. So why in particular is sexuality education in autism something that we should really focus on? For those of you listening, if you have autism or if you don't have autism, if you can think back to your own adolescence and maybe some of the changes that were going on there, right? There are hormones racing through you, the social landscape is changing, people might be starting to date, people might not want to date, that might be an issue, there's a whole bunch of things that goes on. And so sort of all of a sudden you transition from being a young child and there's all these new communication needs, reading your peers, figuring out what you want and who you are, making your needs and wants meet with other people's needs and wants, navigating when they don't. And this maps pretty directly onto some areas that can be challenging along with autism. So trouble with social communication, trouble with identifying emotions in yourself or in others, and then navigating difficult situations when people might have different intentions like dating a romantic interest than they might have a few years previously. And so this is, I think, why it's really critical to think about sex ed programs in the context of autism and what in particular we might need to spend more or less time on to make sure that everyone feels like they're prepared for the rest of their adult life. Another good thing to be aware of, I think, is that there's not always the best information out there, and we need to be aware of what we might be up against with regard to other people's impressions or with regard to our own potential bias or tendencies. So I think we hear oftentimes that people with autism are portrayed as maybe predators, so sexually dangerous. There hasn't been a ton of work in autism specifically about this, but in developmental disabilities more broadly. If you look at the rates of developmental disabilities in sexual offenders, it's slightly but not significantly higher than that rate in the general population. So that is a mess. And then the other side of this is the victim side, so that people with developmental disabilities are being taken advantage of or are at risk, which is certainly true, but there's a big patch of healthy sexuality and health promotion that we seem to be missing right now when we think about sex ed and ways to implement best practices in schools, medical practices, therapy, things like that. So this concept of counterfeit deviance is also one that comes up when we think about sexuality, and autism in particular. So counterfeit deviance is something that appears to have a sexual element to it, but in fact might not really. So a good example of this is a case of a young man with autism who was going from backyard to backyard and stealing women's lace panties from the drying lines and taking them home. So if you think about the headline there, doesn't read that well, right? Man stealing women's underwear sounds like a pretty clear-cut sexual crime and problem. However, when you take into consideration this young man as an individual, it turns out he has a long-standing sensory interest in lace. He's always collected scraps of lace, and then when he takes pieces of lace, he puts them in a box at home and just rubs them with his hand or on his cheek when he feels nervous, right? So that changes it, and also changes how we would then intervene. So there's a balance here between, you can't go around stealing women's underwear. That seems clear, right? But if you know that he's doing this for a different reason, we can intervene relating to the sensory interest and then explain and have some conversations about why it's different having a piece of lace and lace underwear. And that is something I think to keep in mind. This comes up oftentimes in classrooms when students, for instance, might be putting their hands in their pants, and we're concerned that students are trying to masturbate in class, which certainly could be possible, but sometimes students like the pressure, let's say if they're wearing sweatpants, of their sweatpant band in their hand. And so parsing out really what's going on is going to be really important consideration when you're thinking about autism in particular. So what do we know currently? The sexuality in autism, sometimes I think we hear information that people with autism are asexual. This is not true. Asexuality is a naturally occurring phenomenon in humans and non-human animals, and this occurs in autism as well, but it doesn't seem like the rate is that much higher than in populations without autism. And in fact, we find that most individuals with autism desire romantic relationships. Okay? In addition to that, almost 3/4 report romantic experience, this is of surveyed adults with autism, and 10% report a history of a sexual relationship. I think it's important here for a second just to notice the discrepancy between these two numbers. I think oftentimes in the public eye when we think about adult relationships, we might jump straight towards sex, and that this might not be the experience that adults with autism are having. So this could reflect two things. One, that's not a goal. It's something that they're not interested in, and so that could explain the difference, which really emphasizes the need to get a sense of goals of the person that you're working with when you're talking about sex education planning and programming. Or it could be that they also want sexual relationships and can't access them in quite the same way as their peers do. In contrast, individuals without autism report having sexual experiences. About 97% of adults report having a sexual experience at some point. So there's a bit of a gap there. In similar studies, if you look at individuals with autism who are coupled, they report greater satisfaction when paired with another individual with autism. And that generally for all of these pieces, the timing for pursuing romantic relationships, sexual encounters, interest in other people, timing is often later than for neurotypical people. So this brings into question the sex ed programs that we have now. Should they sort of map onto the same timing as we have in general sex education programs, or should we be more sensitive to when this information might be the most useful? So here's where we start to think about, okay, what do we need to do in particular to make sure everyone has access to the appropriate sex ed information? So this study from 2012 shows that in men with autism, they express more sexual thoughts, higher sexual desire, and higher frequency of solitary sexual activity, which is sort of a fancy science way of saying masturbating and looking at pornography. This is coupled with an overall lower level of sexual knowledge, right? This is potentially a bad combination. So if you're more interested or spending more time thinking about sex, but you know less about it, that could put you really at risk, either for infections if we're really talking about sexual intercourse in and of itself, or seeking out sexually explicit material that maybe isn't appropriate. So we really need to figure out a way to address this gap, which leads us straight to sexuality education. So right now in this country, most teenagers receive sex ed before the age of 18. And an important note here, as of 2015, only about 12% of students said that their school sex ed programs covered same-sex relationships. So let's remember to talk about that in a couple of slides. And that generally, programs that are focused on how to say no are emphasized over covering topics such as birth control. There's all sorts of information about this in sex ed programming generally, but I think it's important to note that almost half of teens report that by the time they got information about contraception, they had already had their first sexual experience. So thinking a little bit about how we're timing this and who we're reaching, I think, is key. And that even when we're not considering sex ed programs and developmental disabilities, almost no one learns the social basics. So if you think about sort of the stereotypical sex ed activity where you're putting the condom on a banana, right? The mechanics of that is one part of that activity. But the challenging part of that is there has to be a whole conversation beforehand about how do you have the conversation about if you're going to use a condom, who gets them, who puts it on. And those are really big social pieces, just as an example, that are going to be hard to pick up on as you go for everybody, right? And then if you have difficulties with social communication, you're probably going to double down a little bit on how difficult that is. The other problem that we run into is that it's pretty common for students receiving special education to skip sex ed entirely. So especially for students in self-contained classrooms who aren't in the health or the gym class where sex ed might be occurring, they might not have access to that information. Or they might be tossed into the mainstream classroom for this particular topic, so it's at a level or speed that they're not able to access, which is not that useful. So given that there are a couple of challenges there, obviously, how should we develop sex ed programming that's really tailored to the needs of autism and that is patient or student-centered, so really focused on their particular goals? A limitation to this is that info on sex education in this country is limited. There are huge variations nationally because it's not federally regulated. So this is a chart, just a piece of a chart actually, you'll see, just the first few states, that gives an overview about the requirements of sex education and HIV education across the country. So if you'll notice, this first column here, let me get my pointer out, there we go. This one indicates whether or not sex ed is mandated in that particular state. So as of the end of 2017, 29 states mandate sexual education plus the District of Columbia. In the past couple of years, that just passed, it was at 24 states for a while, so we've crossed the 50% mark, which is good news. But there's a lot of work to be done there, right? The second piece of this is over here on the right. So if sex ed or HIV, STI, or healthy relationship instruction is provided, is it written somewhere that it must be evidence-based, culturally appropriate, and medically accurate? So again, I'm going to take out my pointer. Look at all of these blank spaces, okay? There are lots of spaces here that we have work to be done. So if there's information that's out there, it's not legally mandated that it be based on medical evidence. Another piece I think is particularly important to developmental disabilities is this column on that it should be age appropriate, right? So age appropriate and developmentally appropriate can be two different things. If you have a student or a child with the body of a 17-year-old, but their thinking skills are closer to that of a 7-year-old, sex ed is going to look a little bit different for them. So in combination with laws about being age appropriate, medically appropriate, only 21 states mandate that the education that they provide is age, medically, culturally, and evidence-based. So we have some opportunity to build here, I think would be a good way to phrase this. Which topics should be covered is another big question. So we tend to take the format of what we do know from sex ed programs and pull it over to adapt it for autism without too much thought about the timing, for instance. Or there's some topics that might take more review. I think a question that comes up oftentimes is consent. Consent is a very difficult topic to teach. Only one state in the country requires that students actually receive instruction on consent, and especially as that's been becoming more and more of a media story, I think it's important that we have big conversations about this. And then how do traits impact learning in sex ed? So if you have someone who has a lot of repetitive behaviors and they're trending towards sexual behaviors, we need to figure out particular modules or ways of addressing those behaviors so they don't find themselves in legal trouble. There's also a need for interventions that have high social validity. So when we're thinking about social interventions that happen, it's really important that we focus on what people are doing now and how we can incorporate that into programming. If there is a sex ed program for students who are using phones that does not address sexting, you're missing a really big part of sexuality in this country right now. Teens sext, as we know, but also they've done some interesting studies, and more than half of adults in their 20s and 30s in committed relationships sext with each other. So this is a part of the sort of sexual landscape right now. And so we need to make sure that we're teaching skills that are really relevant to what students might be experiencing. So like with anything else, there are a couple of barriers, right? One of them is this idea of protecting childhood innocence. So for those of you who are listening who are parents, I would invite you to think back to maybe the first time your child asked a question about sex or named a sexual act or body part, and that sort of thinking feeling you're like, we're not ready for this. This is not the time for this conversation, right? And this can sometimes be more severe when you're working with someone with autism, because if they're socially naive or if their developmental level is a bit lower than their physical age, it might seem like they're even younger than they are, and so delaying giving information until perhaps it's a problem. And then that sex ed for learners with autism isn't always a priority until it has to be, until something negative happens and it's like, oh gosh, we have to provide this information. And then even outside of autism, some programs exist, but don't address the social aspects regarding sexuality and intimacy. So this is a challenge for sex ed programming overall, but especially when we're thinking about developmental disabilities. What other barriers could there be? Sex can be difficult to talk about, right? If you're sitting at home, it's like, oh, hi, son, how was your day? How was your math class? Oh, don't forget, we have to go pick up your brother later. Also, we're going to have a little chat about masturbation, right? If your family dinner table talks go like that, good for you. That's not been my personal experience. And so how can we create some comfort about things that usually, teenagers just figure out? And how can we do that in a comfortable way that doesn't create too much stigma around certain topics? So more broadly, when we talk about sex curriculum, having them available is really the most beneficial to teachers, according to one study. But also the personal values of who's delivering that information is really important. So I think this comes up particularly when we think about gender identity or sexual orientation, but also if you have people who are thinking the student shouldn't be having sex anyway, that might limit how they're going to present certain information or how much information they're going to give. But it can also be just a comfort level. And I think it's really important to have a conversation with yourself, and maybe if you have other parents or peers about like, okay, I really don't feel like I can take this on, but maybe you can. How can we navigate this? The other thing in studies of teens without autism is that they don't usually bring sex up with people who would give them good information, right? They might talk about it with their friends, but not necessarily with parents or medical professionals. But when asked about sex-related topics, they respond really favorably. They're usually able to answer questions or to say that they're glad that the person asked. So I think this is a good reminder to us, and if there are any medical providers out there, to work with medical providers to really please ask these questions, even if you're not sure if it's something that's going on for them, to make sure they know that's a good place they can share information relating to relationships or puberty or development or anything like that. So less than 70, or about 70%, of medical students rate addressing and treating sexual concerns as an important part of their future careers, which makes sense, nice and high. But less than 40% feel that they're adequately trained to do so. And I think this is a good reminder for providers and parents to really serve as advocates. And when we're able to say, okay, here's the training we can offer, here's information that you need, we can't just skip over sexuality, right? You need a user's manual for how your body works, whether or not you're going to seek out relationships with other people. And so we need to make sure that as a profession, we're able to do that. So now that I'm saying we should do that, how should we do it? What are some of the best practices? So SICUS, which is the Sexuality Information and Education Council of the U.S., summarizes 6 major areas to address. And if you look up, they have a very large, I've printed it off into a binder, but very large list of topics and how to break them down to different levels, which can be really helpful if you're interested in that resource. But the 6 areas that they suggest are human development, relationships, personal skills, sexual behavior, sexual health, and society and culture. So when you think about sex ed, oftentimes the first things that come to mind are sexual behavior and sexual health, and maybe some of this human development, reproduction, puberty, things like that. When we're thinking about autism and a lot of the social skills training that oftentimes goes hand in hand with folks with that diagnosis, we're really going to want to emphasize some of these other areas as well: relationships, personal skills, and society and culture. And I'll talk about what I mean by that in a little bit. And a lot of these skills take a really long time to learn, right? I like how there's some things like decision making. It's just one small minor bullet point that you would like to learn as part of sex education. But that's a really big topic. And especially if you're working with students or kids who are slower learners, you're going to want to start in on that early to give them the best chance sort of meeting expectations when they're older. So how can we start to have these conversations? How can we approach introducing sexuality education programs? First step here is to develop a common language. This sometimes means you get to do one of my favorite activities. So if you can see this chart, this is called the What Do We Call It activity. This is from a curriculum that was created in England, so there's a little bit of difference from some of our U.S. words here. But the top row, as you can see, is what's considered sexually, like anatomically correct terminology. So breasts, buttocks, erection, penis, etc. The list below are words that are sort of less anatomically correct, I would say. And the way that we do it in our groups is that we present the list up at the top, the row up at the top of the correct quote-unquote words to use, and then we have group participants jump in on what some of the words that they've heard are. And this gives us a great opportunity both to correct anything that might be incorrect, which sometimes happens, and then also just to talk about if they're out on the playground or on the bus and they're hearing these words, or if at some point they're in a potentially intimate relationship and someone uses one of these words, that they know what's going on. A really good example of this is the word pussy, right? That means a couple of different things. If you guess the wrong thing, that could be uncomfortable for you. We hear a lot about make sure you use the scientifically correct words, which is definitely important, but make sure you're pairing that with the knowledge and the language that students are probably hearing when they're not maybe having this conversation with you. And then next to it, these pictures of public and private body parts, this is if you have students who are less verbal, who maybe wouldn't be able to engage in that type of activity. So whatever communication system they're used to using, how can you adapt it to relate to sexual topics or sexual parts? This is important for a bunch of reasons, but one of them in particular is so that if there's a problem behavior that emerges, such as masturbating at school, if you need to shape that behavior, you first need to be able to label it. And so having a common language is going to be a great first stop for that. A second area where it's really good to develop a common language is to talk about gender and sexual orientation. So this is a very cute little visual here. So I'm going to take my pointer out here again. What a great feature. So the first one here is gender identity. So this is the brain that's up here. And this is how you think about your own gender. So this is defined from woman to male. And this is the little brain we have up here. So what you consider yourself. So this could be woman, man, non-binary, so somewhere in the middle or anywhere along that spectrum. The next heading below this is gender expression. So this is how you present your gender, what you dress like, how you act, and this goes from feminine to masculine, and again on a spectrum, so you can be sort of anywhere between those 2 points. And then down at the bottom, we have biological sex. So this goes from male to female. This is considered the sex parts that you're born with or your genetics. There's sort of a more complex story here, but generally from male to female. And these topics come up more and more sort of in media, in movies, at school. And so both in learning what these topics are and having a really good understanding of that, and then also being able to answer questions about terms that are appropriate to use and inappropriate to use, really critical. And then down at the bottom here, we have sexually attracted to and romantically attracted to. So these are sexual orientations. So heterosexual, bisexual, homosexual, asexual, those all fall under these couple of headings. So this is important both because these can be complex topics for anyone to parse through, so to have a nice visual that breaks it down can be good. But there's also some emerging evidence that sort of fluid gender is more common in autism. So individuals with autism might be more likely to move along that gender spectrum as they move through life than people without autism. There's also some information to suggest that sexual orientation is more likely to be non-heterosexual, so homosexual, bisexual, asexual, etc., than people without autism, especially women with autism. There's higher rates of bisexuality in women with autism than in the non-autistic population. So it's really critical to understand these pieces from an education point of view, but we also know from work in gender identity and sexual orientation that understanding your own identity, being able to ask questions, and to have some clarity around that is really critical for mental health. There are a lot of negative mental health outcomes to not be able to do that, increased risks of depression and anxiety, dropping out of school, things like that. So making sure that you're having some conversations about this, especially if you're working with students or kids who might be more likely to be experiencing identities that fall outside of what they might be learning in their sex ed or health classes at school. All right, another best practice, probably goes without saying, is to use teaching strategies that have previously been effective. So is sex ed different than talking about other topics? Yes and no. Visuals and visual schedules, if there's something that have worked for your students, they might look a little bit different, but you can adapt them just like anything else. There's a center nearby here called the Robert Crown Center where they have these pieces cut out and put on a little metal ring that girls can take to the bathroom with them that that gives them information about how to change their pad. So they're used to this format for other stages of their day. This is one that's used relating to periods. This is another model that you can sort of build on. A lot of schools use this circle curriculum. So to talk about boundaries and relationship building, the individual with autism is in the middle there where it says me, and then there are intimacy circle, friendship circle, and so on. This can be a good way to structure who you can ask questions about. If you have an erection, you can ask your mom and maybe your teacher, but you cannot ask the crossing guard. So building on what they already know to integrate some of this sex ed information. And this is a slightly more complex way to do it, but being really specific about the do's and don'ts. This is a chart from a book that you'll see in the references that gives do's and don'ts for approaching a date, right? I like the row about complimenting in particular. Do compliment someone you're on a date with. Do not insult or criticize them, right? Making it really clear. And if that's something that is helpful for you or helpful for someone you're working with, then that is a good method to use. Also social stories, maybe a little bit of a different topic than you're usually using for social stories. There's some that already exist out there, or you can create your own using the formula for building any sort of social story, either for puberty generally or situation specific. The other pieces here are to reinforce across time and settings generalizability is really important, like with anything else. So if you're practicing at home, if you're practicing at school, reading through some of this material, looking at pictures, reading these social stories, trying to do this in as many different ways as possible. Practice is another piece, so especially if there are social components of this. How would you ask them on a date? How would you say, no, I don't want you to touch me, for example? And then being sensitive to maybe some of the sensory needs that might come up, right? Wearing a pad, shaving, those have really big sensory components to them. If there's the scent of deodorant bothers someone. So as much as you can practice that before it's mandatory or really necessary that people are using these particular tools, that can be helpful as well. And then using props. We have anatomical models, sort of like medical models of the reproductive system, like the penis and the testicles, and that we bring those to class and have students look at those. We also label sort of on paper, but having something that's a little bit more lifelike can help put into context the information that we're providing. All right, so we've talked a little bit about developing a common language, using effective teaching strategies, and then the social context is really important to discuss as well. Topics relating to sexuality and development are all around us, right? This leaves us for some really good opportunities for discussion, but also some possibilities to internalize some misinformation. So here's a picture of 5 female police officers, okay? These 5 ladies probably serve different purposes based just purely on the photos, even though they're playing the same character. If you have students who might be confused by this, it's really good to talk about what makes some of these police officers and what makes some of these dressing up as police officers but more sexual. This can also be really important to talk about when I feel like they have more and more Halloween costumes for young girls that are sort of sexualized policeman outfits, and making sure that we're saying, okay, this is appropriate, this is not appropriate, and here's what a police officer really does and what they would wear. Another piece of this is movies and television, right? So the image of Ryan Gosling there, for those of you who have not had the pleasure, this is from the movie The Notebook. This is a young gentleman who fell in love with a young woman, wrote her a letter every day for a year, and then came back and bought her a home. She did not respond to him for the first big section of this, so if you're Nicholas Sparks and you're making this big Hollywood movie, this is a wonderful romantic story, but in real life, this is pretty stalkerish. Similarly with Aladdin, wonderful movie, fantastic music, right? But he dresses up as someone he isn't, and then when Princess Jasmine doesn't want to get on this flying carpet with him because she's afraid, he cajoles her into it. It's fine, come on, you can do it. So there's opportunities to have conversations about what some of these might look like in real life. And I apologize if I just burst anyone's bubble about some of these movies. They can also be very fun to watch. Another element of best practice is to start early. So I've been talking a little bit about sexuality on the older end of the scale, but sexual development starts from when we're little. So this chart here shows what's appropriate for infants, what you can expect and what are common behaviors, and then ways to encourage healthy development. So there are a couple of these charts in existence out there. This can be a really good tool, especially if you have or are someone where your physical age and your developmental age are a bit different, keeping in mind that we always need to be teaching people how their bodies work, even if it doesn't feel like it might be a great fit developmentally. But this can be a really good source of information for building a starting point. And I won't spend too much time on this soapbox, but we know from research outside of autism that starting sex ed programs has really good outcomes. So just starting in England and about to start and going on for a long time in the Netherlands, they have sex ed programs that start right when children start school. Now, this obviously isn't the condom on the banana activity when they're in kindergarten, but this is conversations like, oh, when grandma comes to visit, she leans down and gives you a big wet kiss, and you don't like it. What are some things you could say? And they practice ways of responding to that, so they're teaching them about boundaries. And this has good payoffs. So the teen pregnancy rate in the Netherlands, who's been doing this programming for a long time, is much lower than in the U.S. And then qualitatively, when asked about their first sexual encounter, teens and young adults in the Netherlands describe it as wanted and fun, and most teens in the U.S. longer. So not letting the age of how early you start reviewing these things deter you, because it leads to good outcomes. Good practice is to create comfort around uncomfortable topics, right? Unfortunately, oftentimes the first time that sexual topics come up is when a student is caught doing something they shouldn't be doing. If you have a student or a patient or a kid who's pretty nuanced in their understanding, that's great. But if you don't, having a really strong negative reaction when they get caught masturbating, for example, could make it difficult for them to differentiate that it's okay to tell you about something when someone has touched them inappropriately. So if you're thinking long term, trying to keep reactions calm and neutral and fact-based as much as you can. Encouraging and modeling questions, I already chatted about that a bit. And then if you have students who might have more complex or advanced questions, offering ways of confidentially asking questions, so a notebook, leaving questions in a box, something like that. So there are a few programs out there already. There are actually a number of sex ed programs you'll find in the literature that are designed relative to autism. Our sample sizes tend to be small, so it's a growing literature. There's a lot of really cool work being done. There are a couple of here that I've included just for your information. This first is a sex ed program built within the TEACH model, and that has 4 stages that is based on the cognitive level of the individuals participating in the group. So the first one being that you can label different parts of the body, what to do, when to do it. Steps 2 and 3 are going over hygiene, how anatomy and functioning relate to sexuality, and the 4th step being emphasizing social relationships if students are advanced enough to reach that topic. And then the Intimate Relationships and Sexual Health book, that's the British book that we pulled the What Do You Call It activity from. We did a very small pilot study here on that and found that students had significantly better responses to short social vignettes, so identifying a problem in a situation and what they would do after they've gone through this curriculum. This is a very verbally based curriculum, so oftentimes, sometimes we'll use it directly in groups, but oftentimes we're also adapting it so it's a bit simpler. So here's one activity when we talk about development, which we can have a conversation about or do a writing activity, but we also cut out pictures of people across the lifespan, and then a little squares down here are flashcards, and we have students go around and match up who goes where, which can be a lot of fun. The Tackling Teenage Training is an individually based program, so this is 18 sessions working one-on-one, designed specifically to cover sexuality education and autism. And they go over a lot of the topics that we've talked about, including puberty, sexuality and sex, things like sexual orientation, masturbation, and safe intercourse, but also things like what is the first impression, why is it important, how do you become friends and maintain a friendship, how do you set and respect boundaries, things like that. So a real emphasis on that social piece, which so oftentimes gets missed. And then this Teaching Sexual Health site here, I don't know as many studies about this one, but I see there's a number of teachers on, and this is a Canadian source, and they have listed by grade all sorts of different topics. These are also available in French, and they do have a heading that says differing abilities that's directed toward individuals with special needs, and these are ready-made course activities, but then they also have a section that's specifically for parents that helps give them information about understanding healthy development as well. So this could be a good free resource for you all to check out if you're interested. So what should we do next? How should we keep moving and keep growing? Continue development of screening and assessment measures, making sure that they're sensitive to the needs of people with autism and families with autism. We need to make sure we're listening to those folks. Keeping curricula current, okay? All of these things now factor into sexuality. Facebook, Snapchat, you can talk to other people through your gaming console, texting people, etc. Need to make sure we're emphasizing that, and that's factoring into the information we're providing. And then emphasizing the social validity of curricula. So a great example with this one is they just finished a very cool study in Arkansas where they surveyed college students and asked how they said no to sex. They completed this big factor analysis, and they boiled it down to 21 ways that individuals refuse sexual intercourse. There are 3 types of ways. One is direct verbal, so they say, no, I don't want to have sex with you, or no, I don't want to make out with you. Another one is indirect verbal, so, oh, I have a test tomorrow, something vague like that. And the other one is indirect nonverbal, so maybe they turn away from you but don't say anything, or maybe they don't respond to your text messages. This sort of communication is going to be really important to provide, especially for someone who struggles with social communication, so that they can read those cues in context. If you have a sex ed curriculum that is basing its consent on, did the person say yes or no, you are missing 20 creative ways which yes or no responses might be happening. So making sure we're pulling from what we know scientifically to be true about intimate relationships and social relationships and having that inform these curriculum is very important. Improve the accessibility of these programs, right? Study them if you can. If you're interested, there's lots of information about there. My email's on the last couple slides here. Let's chat. Offer them. I think sometimes people are a bit intimidated by this topic. That's fair, but you practice saying penis in front of the mirror a lot, it gets a lot easier, a lot faster. And then also talking about them. Oftentimes we have families who come in and they say, I didn't know this existed. There aren't a ton of programs, but there certainly are some. So checking around and just making sure that parents and teachers know that this information is available and out there. And then using a systematic, empirically driven approach to developing sex ed programs. And that's what I'm trying to do with my research program, is to break down how we study sex education. And then in autism in particular, what topics should we be looking at that we're not, and how can we isolate them to identify the effects of each topic and how useful it was over time. And that we really can't do this without asking people with autism what they want to know or what they wish they had had. And hopefully this will be available through the Spark portal in the next couple of months or so. But we just launched a questionnaire for adults with and without autism that asks about their sex education experiences, topics that they wish they had more time on, topics that were not covered, and how this relates to some of their social and sexual functioning now. I'm really excited to see what comes out of that. So certainly if that's something that you're interested in, you can contact me using the slides at the end here. And so I'm just about at the end of my time, so briefly just want to thank my arts team here in Chicago. We have a great group. We work with folks all across the lifespan. And then you'll see, I think later today or maybe tomorrow, there'll be a couple of other documents uploaded. One is a sex ed resource guide. This is fairly brief. We're just creating it, but Dr. Leonchik, Dr. Pierre, and Holly Lechniak and I pulled this together as a starting point for some resources, which could be helpful. And then some forms that we just use. These are not empirically derived or anything, but based on clinical conversations we've had with families. Okay, how do we move from concerns about sex ed? What are some next steps we could take? And I will wrap up there and I guess open the floor for questions. Thank you very much for listening.
Thank you so much. This was great. We do have a few questions that came in. Others can still type theirs into the Q&A box, but I will get started here. Do you have any recommendations about children who might be nonverbal or adults or teens?
Yes. So that's a really common question. So sometimes it can take a little bit more legwork. There certainly are some curricula that have small levels of support with them, but it's oftentimes adapting these things down. So if you have a student who can discriminate between two choices, boiling some of these activities down between, okay, here's a yes and a no, here is this part discriminating from this part. So that we have some resources here that we have developed, but also in the resource guide, some of the sex ed curriculum are more visually based. And you can certainly follow up with me if there are more specific questions, but oftentimes it's just adapting what's written on a more verbal level for students to access who might not be as verbal.
Okay, thank you. This is similar to the lace example. So someone's child is very interested in texture of clothing, and the child says something to the extent of, I want to rub your body. So how would you recommend going about that situation? They've tried modeling and social stories. Do you have any additional recommendations?
Yeah, I think those are two great starting points, right? Making sure that there are opportunities where they can safely engage in that behavior, which is similar for what we do for masturbation. So if you can't do it with your peers, we're going to give you right now a break at the end of every class where you have this little box and can touch all of these different fabrics. And that particular phrase, if that's one that this kiddo is stuck on, that we won't be using anymore. What are some replacement things we could say? So I feel like I need to touch that shirt, and that can be an indicator to his team to use this box. And then once that is established as a good replacement behavior, trying to whittle down from there. So it might happen a lot at first, but the goal would be to get this particular kid away from touching their peers.
Okay. So we have someone in attendance that works with young men in their 20s, and they're wondering if there's a more age-appropriate version of the genderbread person that you would recommend for this population?
I actually use that with all ages. There's a gender unicorn, but it's the same thing except a unicorn. So yeah, I haven't found that to be too problematic with some of our young adults, so I don't know of a different one. That's sort of the primary one I've used. Sorry, that's not more helpful. Yeah. No,
that's great. So someone has a child, well, I don't know if it's a child, but a son or daughter, or a son here that's 6'4", 295, severe autism, so quite a large individual, and she's worried that if in a sexual situation that he might be aggressive or not take no for an answer. So how would you broach a conversation around that? Or
yeah, that's a really tough one because that pulls on social skills, emotion regulation, generating alternatives and things like that. I think trying to break that situation down into as many of those pieces as you can and doing a little bit of role playing, right? So when someone says no, what are some things that you do? Did it say whether or not this individual was verbal?
It says nonverbal, so.
Nonverbal, okay.
Yeah.
So setting like sort of if-then visuals. So if someone says no, here's some other things you can do. That's a really tough one. And as often as you can do that, I think the better. I think sometimes we underestimate how long it can take to learn something like that. But that would be a good starting point. But that's a tough one.
Okay. So someone is asking about a 14-year-old that's interested in kinky stuff. So this is a tricky topic, but how would you would you recommend visuals in this? I mean, how would you begin to even talk about that?
Kinky stuff comes up here a lot. I spend more of my day talking about pornography than I thought I would at the start of my clinical training. So exactly what you're saying is a great first start. So think about like any other behavior that you want to extinguish or reduce, right? What are the rules and expectations? When can you do it? Oftentimes really emphasizing the legal component of this. Some students that doesn't make a big difference, but some students simply didn't know, like you cannot look at pictures of people under the age of 18, right? There's a big legal problem with that, and here's what it is. So providing that information to sort of help them, make the best choices possible. And then understanding, if it's kinky but not illegal, when and where can you engage in that behavior or interest, and making sure that wherever it's happening that it's safe, and where can you get good information. Individuals with, any teenagers who are trying to get information related to sexuality sometimes pull from the internet, but that same study that I mentioned before, they actually don't prefer to get information from there, which is great, but to provide them a sort of non-judgmental, safe way to get that information is going to be really important as well, so they're not feeling like they have to hide it.
Okay. In your resources list, did you include any information that are trans-friendly, or would you recommend any?
Yes. So there's a couple of books that are not autism specific, but about how to talk about trans, gender identity and sexual orientation, all three areas specifically. So those are in the resource list.
Okay, and then
if
just
people
as a
have
reminder,
oh, sorry, go ahead.
I was just going to say, just as a reminder, the slides will be uploaded to our website. So. I guess you mentioned that there's maybe only one state that teaches consent. Do you happen to know what that is?
Oh, let's see. I actually have that right here. I can pull that up.
Okay.
This might take a second. We can go on to another question as I'm digging through if you want.
Okay. Let's see. This might be a tricky one, but is there a certain age that you would recommend to start talking about sexuality?
Yeah, so I would say to start talking about topics relating that are like early precursors of sexuality education as early as possible. I think there's sort of a misguided expectation sometimes that we're not going to talk about boundaries or consent, for example, until someone is 12, 13, or 14, and we've missed out on 12, 13, or 14 years of good learning and to prepare for a really complex topic. I think we learn all our social skills across our lifespan, right? We start to learn to share when we're little, and that develops into other skills that are important as adults. And so same with sex ed. So if you're talking generally about the social skills related to that as early as possible, sex in particular or puberty earlier than you think you have to, especially if you are working with someone who is not that enthused by the idea of change. And so giving that information in the form of social stories or talking to other people who have gone through it just to normalize some of it, especially with periods and pubic hair. Those can be surprising body changes that come up. And the earlier you prepare for that, the better.
Okay. Do you have any recommendations off the top of your head of a resource where you can find a program offered locally related to sex ed for young adults with autism?
I haven't found a particular like a place to search for that beyond, like sex education, autism in the city you're looking for. What I have often found is that if you're looking on Google Scholar or PubMed and you look up either autism in sex ed or developmental disabilities in sex ed, you can find, if you find articles by certain research groups, then you can look at that particular university to see if they're holding research groups. There tends to be more sex ed programming and information out there related to intellectual disabilities, so that might also be a good starting point. They might be able to connect you with people who might know.
So I'm trying to make this into a broader question. If you have an individual that's an adult who's never had a romantic relationship, how could you broach a conversation to talk about if the person may be asexual or just very introverted and not know how to navigate romantic relationships?
Yeah, I think laying out those options is a really great way to start that. So just that some people are interested in pursuing romantic relationships. Some might not be now, but might be in later years, and some people might not be at all. So just to provide information about that any of these states of being are okay, and that might change in the future. So I think connecting people with all the options is really important, and then that can lead to some hopefully productive conversations about what comes next.
Do you know of any research about numbers of relationships where it's two individuals that are both on the spectrum?
I do not, and that's a question I've gotten before. It was not in that particular study that other stat is from, but if I find it, I will find a way to communicate that.
And then what about any challenges within dating for individuals with autism? Is there any research in that regard?
Some of the, like dating when both people have autism?
I guess either or.
Okay. There's not a ton out there that I know of. I know there's some resources for couples counseling that the way I read it tends to be more directed when one individual has autism and the other person does not. But I don't think there's been any large-scale study of that. And I did find, so the state that mandates talking about consent is California.
All right, thank you. Mm-hmm. What about how to begin a conversation about a student that may have left a school because they're transitioning? How would you begin to describe that how to talk about that?
Where they're going to a new school as a different gender?
Yes.
Yes. So I think a really clear conversation about what that means and how playing out different parts of gender might come up in their new school, like using different bathrooms, switching names. What happens if someone asks about something you did when you were younger and that will somehow, tell people that you used to identify as a different gender, and is that okay with you? So I think being mindful of and proactive about some questions that could come up. And I wouldn't imagine that would be terribly different from some of the information out there outside of the autism literature. I know we've worked with a number of families at the center who have made the choice to switch schools as they're going through a gender transition. And there are also parent support groups, which I haven't mentioned at all, but can be a good way to swap information, especially in your city or area in particular, to get just ideas about resources and which doctors might be good and things like that.
Okay. I feel like I'm asking a lot about resources, but do you know of any place where parents could access information about individuals that may have been in trouble with the law and how to navigate that?
Yes, so that's a great question. So our former clinical director, Rachel Lofton, is in the process of starting a forensic and autism center at Yale, and there's not a lot of resources out there for that. But she could be a good starting point for sure. Yeah. And then I think from the legal side, oftentimes getting access to sex education, sometimes we'll get calls about students who need, by sort of mandated they go through some sort of sex ed programming. So that can be a good way to seek out other services as well. If that makes sense.
And I think you may have mentioned a statistic about risk of abuse in children with autism.
Yeah.
Do you happen to recall that?
Yeah,
Someone was just asking.
Yeah, it's about twice as high. The rate in the sort of most recent stats that I've seen anyway, and outside of, or not autism specific, I guess, is that in their lifetimes, 1 in 3 women will be sexually assaulted or abused, and then 1 in 10 boys will be. And so the thought is that is about twice as high in developmental disabilities.
Okay, thank you for that. So I think we're going to wrap things up here now. We really appreciate you doing this for us and offering up your contact information. That's sincerely appreciated.
Yeah.